And welcome, everyone. We are so glad that you could be here to join us today. Scaling healthcare organizations is no small feat, not for the faint of heart. It takes much more than just smart business strategies. It really requires a deep commitment to the mission, to high quality leadership, and the ability to inspire the people behind it. As Maria mentioned, my name is Addam, a managing principal at FMG Leading. We are a healthcare-focused advisory firm on a mission to support leaders and organizations that are transforming healthcare. I'd also like to thank our partners and the team at Modern Healthcare for bringing together this really important conversation. Today, what we're going to be diving into what it means to expand healthcare organizations in a way that not only really grows value and increases the access to care and improved outcomes, but also creates, amazing places to work and enables sustainable transformation. So whether you're navigating that challenge of scaling right now or you're preparing for it in the future, you're in the right place. We are honored to have with us today three extraordinary leaders who are in various stages of growth, facing hurdles or having overcome hurdles of rapid scale while keeping their focus on what really matters most. I've had the privilege of knowing and working with all three of our panelists, whether it's over a number of years or sometimes in a couple different organizations, and we're going to be having a great conversation today. So I'm thrilled to introduce you to Binoy Bhansali, the CEO of Diverge Health, Jennifer Webster, the CEO of DispatchHealth, and Mike Kotzen, the CEO of Community-Based Care. In this session, we're going to be talking about, and our panelists will be sharing some key strategies that they've used to successfully grow their organizations while staying true to their mission of improving healthcare. You're going to walk away with insights, real-world examples, and some practical advice that you can apply in your own journey. So wherever you are, whatever time zone you might be in, grab your midday cup of coffee, settle in, and get ready for a great discussion. And first, I would love to provide our panelists an opportunity to introduce themselves, what they do, and their organization. And Binoy, I'll start with you. You can get us kicked off.
Perfect. Thanks, Addam. Binoy Bhansali, CEO of Diverge Health, as Addam mentioned, and Diverge Health partners with primary care organizations focused on serving the Medicaid population and wrapping those practices with very significant local infrastructure, local community health teams, practice support representatives to help us collectively succeed in value-based contracts with health plans. So very happy to be here.
Thank you. Jennifer?
Thanks, Addam. I'm Jennifer Webster, CEO of Dispatch Health, and we provide high acuity care in the home with the goal of avoiding unnecessary hospitalizations and ER visits, as well as providing a top-notch patient experience to the patients we serve. We partner with health plans, value-based providers, and health systems across the U.S. in over 40 markets today.
Thank you. Mike?
Hi, everybody. Mike Kotzen. I'm the CEO of Community-Based Care. I'm sure I will refer to it as CBC somewhere along the road here, so we'll call it CBC from here on out. We are a in-home based services company focused on individuals who need support in their homes across populations that are seniors, individuals with intellectual and developmental disabilities, and veterans. Today we're serving about 6,000 individuals and families across 6 states, and we've had quite the growth story that I'm excited to talk about.
Yeah, we're excited to hear about it as well. So thank you for the brief intro, and let's get into it a little bit. Let's tell us a little bit about your scale journey and where you are on the path. And Binoy, again, is probably our earliest stage company. Why don't we start with you and tell us where you are on the journey?
Yeah, so maybe taking us 2 years or so back, had the privilege of partnering with 2 organizations and a set of people to get Diverge Health started. So partnered with an organization called Triple Aim Partners, led by Andrew Hayek and Corey Roberts, and the folks at Google Ventures, Ben Robbins, to get us started from a funding and an operating infrastructure perspective. And I guess fast forward 2 years, right? We spent 2023 really honing our model, and then from there have seen some good rapid growth across 4 states. Our model is quite a bit more powerful with depth as opposed to breadth. So last year has really been about picking our states, contracting with providers, contracting with health plans, and then going deeper with those providers and health plans over time. So it's kind of fast forward 2 years where we are about 70 employees, growing to over 100 in the coming months as we continue to deepen our presence across these markets. So that's the short of it.
And really trying to reach, if I recall, some markets that aren't necessarily being served with some of the services that you provide. So reaching into some of those other markets. Yeah, great. Thank you. Jennifer.
Yes, thanks, Adam. I will also do a quick rewind as well to, Dispatch is actually almost 10 years in its making. It was founded by Dr. Mark Prather with a vision of coming out of being a 20 plus years in the emergency room and knowing that there had to be a better way to deliver healthcare to patients and so be supportive to them and their families. And so, I would say where we are, on that growth journey is there's a point in time, especially early and mid stage, where you're figuring out how to grow, and you're doing lots of different, what I like to call flavors of your model, to find out which flavors are really going to be the ones that are going to be the most impactful to you as you go forward. And so where we are today on the journey is, moving from that sort of growth in a lot of different places to really honing and maturing the way that we grow. And we've done that through really spending a lot of time really understanding our unit economics, like what really drives value to Dispatch Health, and what the archetypes of the model that we have that really it does resonate, not only clearly with our patients, but with those partners that we are delivering those services on behalf of, and really making sure that we have a demonstrated ROI and returns to them in delivering the care model. So really focusing on that unique value proposition. What do we bring uniquely to our partners and to our patients, and really getting focused on delivering that really well in the same way all the time.
That's great. Thank you. Mike, how about CVC?
How about CVC? Well, CVC, we're not quite as far along in the journey as Jennifer just described, but we've had quite a journey. Time tends to move at a different pace for us. We were founded in 2015 with about 250 clients, about 15 million of revenue in North Carolina. And initially, the focus of the company was around services in the home to support individuals and their families with intellectual and developmental disabilities. So, we set out to, in what is a very fragmented industry, not only in North Carolina, but across the country, to really help try to pull together some scale, help professionalize the industry where we could, and hopefully provide higher quality services. The bigger we get, the more we learn. Fast forward, today we're in 6 states. We're serving about 6,000 individuals, north of 200 million. We've done acquisitions, and M&A has been a big part of our growth, as has organic and some support from our payers in the states. We've done about 45 acquisitions to date to grow to the scale we are. And our team, really embraces new members to the family. So we like to think of ourselves as a big old family with 45 relatives along the way. And the journey's been great. I mean, most notably in 2021, we partnered with Martis Healthcare Partners to support our journey. At that point, we also made the decision to leverage some of the infrastructure we had built from a support services perspective, and really try to use those same kind of muscles to launch the home care division of our company. So in the last 4 years, a lot of our growth has been focused on more seniors and veterans who need that support. Yet all facets of the business are continuing to grow, and really just focused on, providing services in the home, which the value proposition for us, for our states as partners, is they can serve a heck of a lot more folks in their home than they can in institutions. And we also believe that's a higher level of quality. So been quite the journey so far, and more to come.
Thank you for that. Really, really awesome and exciting stories in all three of those cases to follow and track the progress that you're each making. One of the key things that comes out as you're trying to scale a business, whether it's in that early stage or through a lot of M&A, there's a lot of the facets of the people side of the business that really factor into your ability to scale. And I'm just curious from your experience, Binoy, what are some of the key obstacles that you're facing on the people side of the business?
Yeah, maybe three things to highlight. So the first is at a company our stage that, let's say a large majority of the folks that are currently in the business were hired in the last 12 months. And we're also a remote company, right? No headquarters in any location. Our central team is spread out across the states. So the simple stuff of who is doing what, how we make decisions, that is tough to get right? Simple, but tough to get right. And so some of the things that we're trying to do, right, to get at that is over communicating. Given we're more of a remote workforce, just getting into the practice of writing it down, saving it down, having a shared library of resources for folks to access, making sure there's good organizational clarity on priorities, all the mediums to do that. So that is one big bucket. Another one is the majority of the workforce that we hire in a community to serve patients are folks from that community. So many of the employees that we have look and feel similar to the patients that we're serving, right? And that was the point of the model, to build upon really the existing trust, local know-how in a community by hiring folks from that community to serve folks in that community. That also means that some of our employees are facing many of the same healthcare and social needs issues that our patients are facing. And that is frankly really hard to see and wrestle with, and why we've taken an aggressive approach to how we think about benefits for that workforce particularly. So that's number two. And then number three, my colleague and our chief population health officer spent about 10 years building an organization that we then folded into Diverge at the onset of starting the company, whose goal was to empower folks from a community to learn enough about chronic conditions to make a difference as a health coach to folks from that same community. So that's hard work, right? You teach someone that may not have had any experience in healthcare, may not have gone to college, about medications and lifestyle management and what A1C means. And that is going to be hard work for a very long time. It's also very empowering. We had one of our health coaches say the other day that because of the training they went through, they're actually thinking about going to medical school because they were so excited and interested in learning about blood sugars and insulin and the molecular biology of it all. And so very empowering, right? Inspiring, frankly, to see it, but also a tough set of goals, right, to try to achieve. So the three that come to mind.
Curious for Jennifer or Mike, what are you seeing right now on your journey?
Yeah, sure. And I would echo, Binoy's comments about connectivity and communication, especially in this post-COVID / remote environment. We are largely remote as well, at least from a support services perspective. We have local market teams in each one of our markets, but so they tend to have, more cohesion and more day-to-day interaction. But for the vast majority of the organization that is working remotely, staying connected is so important and so challenging. So I definitely echo that. We are using a lot of town halls, a lot of targeted types of communication mechanisms, bringing different kinds of groups together, as well as spending time in our markets as a leadership team. For example, next week, I and the members of my leadership team will be spending time in our Florida market. So really getting out at the point in which our care teams are delivering care to our patients and to our partners. And so, in addition to those things, I would say, we're all in healthcare services. I mean, just hiring and retaining top talent is so critical. And I think we all struggle with it, and you have to find ways to incent and inspire teams and of folks to want to come and be a part of the journey that we're on. So here at Dispatch, what are the things that really resonate for each type of employee we have in the organization? Because it's not just a one-size-fits-all model where we have a multi-tiered clinical structure where we have medical technicians, we have APPs, we have medical directors, and all of those types of folks want and need different things. And so you have to be able to find out and make sure that as you're designing, Binoy, you commented on the kinds of benefits plans and other things that resonate, you're really continuing to really understand what it is that your employees want and need, and your teammates want and need is just so critical.
Yeah, and it would be hard to disagree with anything that Binoy and Jennifer just said. I think just a couple points. For us, the thing we don't ever want to change as we continually evolve as a company is the affinity that our frontline staff, our direct care workers, our CNAs have with their clients and their families. Because regardless of what particular company they have come from, if we've acquired it through M&A, that's where their true affinity is. And no matter how big we get, that's something we want to continue to embrace and make sure the frontline employees recognize we know the value in that. And hopefully we can return some value from to create some more of that loyalty. I think some of the challenges that, we've run into, and I'm proud of the way that we've handled them, is, at different stages in the company, it requires different skills from a leadership standpoint. So I feel like we're constantly kind of balancing how do we develop our own talent internally with being honest about the points at which we need to bring in some leadership from the outside. And I think if you look at our executive team on down the line, we have a really nice balance of that. But the reality is, if you pick any discipline, human resources, quality and compliance, finance, it's a different level of leadership that you need at $150 million of revenue compared to 30. And we've really spent a lot of time trying to keep folks in the right roles so they can stay with the organization and try to find that balance on the outside when we need to bring in talent. Would always prefer developing it, but the reality is at the pace we move, it's not always practical.
Thanks for that. And I would echo too, a lot of what we see in the business really resonates with your own experiences, that as your workforce grows, as you expand your market footprint, you scale your operations and the different areas where you're providing your services, it can be really difficult for people to feel that sense of connectivity with the main platform, the main business. And Mike, you were saying that there's already a lot of inherent affinity with kind of the former or legacy organization in an M&A situation. I know that's something that a lot of healthcare services executives really, that's a challenge that they face, is how do you build the sense of belonging to the bigger organization? And I'm sure that's probably something that's on a lot of leaders' minds right now. And I suspect we'll get to it. We're going to talk a little bit about mission momentarily. So I suspect we'll probably get to some of the answers about that, but it'd be something interesting to revisit. But just one final question as we build on that part of it. How are you finding and balancing the need for growth and scale while also providing increased access to quality care? And Jennifer, I'm curious if you have any thoughts maybe about that in your stage.
Yeah, sure. Happy to start. And, I think it all has to start with that clinical model, and it all has to start with the quality of the care that is being delivered. That's foundational, because if you don't have that as a healthcare services organization, you're not going to get very far. But then from there, really building on that, taking a real data-driven approach to ensure that we're meeting those quality metrics and keeping patients. So for example, in our case, keeping them out of the hospital when it's clinically appropriate to do so, and being able to actually measure that and demonstrate the results in our ability to do that. Because when we do that, we earn the right to, expand our model and demonstrate to our partners the impact that we're having on the healthcare ecosystem and the ability and why they should, partner with us and help expand that access to the high quality care. One of the things that Dispatch started, very early on in its journey was, at the point of care, collecting real-time feedback from our patients. So we actually do survey every single one of our patients as we are serving them and as it's appropriate to do so. And for example, we're really proud of the fact that we have a almost 98 NPS score. So, I mean, our patients are validating that what we are doing for them is high quality care, and it's leading to really high patient satisfaction. At the same time, we've got to make sure that we're balancing and, continuing to keep that patient first, but also making sure, going back to what I said a moment ago, demonstrating that value back to our partners, because, within the US healthcare system, the end patient receiving the care isn't always the one that's paying for that service. In most cases is not. So we have to make sure that through that data-driven approach that we are demonstrating to them that we are delivering that high quality care. We're keeping their patients healthy and safe, keeping them out of the emergency room, keeping them out of the hospital, and treating them in the place that they want to be treated. Like most patients, if given the choice, would much rather be treated at home than have to sit in an emergency room or be in a hospital bed. So, our ability to come to patients where they are, where they want to be, that also helps to drive that increase in access over time, because a patient will be more likely to want to utilize a service like DispatchHealth, for example, than, oh gosh, I have to go to the emergency room, or oh gosh, I'm going to be sitting there for hours and hours on end when I'm really sick and I don't really want to be there. So it's just, it's an opportunity for us, balancing being patient driven, but being really aligned with our partners to make sure that there's a true value in the service that we're delivering.
I love that idea of the mutual value. And I know you mentioned earlier looking at the unit economics and making sure that all of those pieces match up, because you're right, it is about creating that mutual value where you're providing the quality of care and making sure that your stakeholders are receiving that return as well. Mike, what would you add to that?
Well, first of all, Jennifer, the more you talk, the more we probably need to talk after this, because we are so aligned in our thinking around keeping people at home. But I think, for us, and I don't know that we knew this kind of setting off on this journey, but growth has been precisely the thing that's enabled us to make the investments to drive quality of care. For the services we provide, that largely is being there for the folks in their homes when they need them. So I think about some of the technology tools that we've brought into play that ultimately are intended to free up more time for both our staff and our supervisors to spend client and employee facing, right? So those are investments we could not make but for growth. And I think even, fundamental to our business is, and I know it's a huge part of Jennifer and Binoy's as well, is staffing cases. There's no shortage of need out there for the services we provide. What makes the difference is our ability to actually meet that need. And because of our growth, we've been able to invest pretty significantly in a recruiting machine that hopefully, again, gets people better access and more continual access to care, combined with some of the other things that we talked about around retention. But as I look at our space, it's hard for me to differentiate growth and quality of care. There's ways to get there when we were smaller, but it was a lot more kind of hand-to-hand combat. And this is still a work in process, but we've made significant investments to ensure that our team spends the most time possible with the folks, quite honestly, that they love, and that's the clients and families they serve. So I think that's been the biggest difference, at least from my perspective. And I would hope that many of our team would say the same thing.
Well, I appreciate that. And you're already starting to touch on, and we've started to talk a little bit already about the idea of mission and purpose and how that might play a role both in terms of retention as well as, the role in growth. So tell me a little bit about how you're engaging mission and the purpose of your organization as a support mechanism to accelerate growth. Mike, I know this is something that's really important to you and the focus on mission and culture and all the work you're doing at CBC right now. So maybe you start us off and just tell us how you're engaging that for the purpose of growth.
Well, in 2021, we engaged a consultant to help us take a step back and look at mission, who happens to be on the screen right now. But it's so important to the work we do, because the hearts and minds of our entire company is all around service. It's around that purpose. And the way we talk about growth is impact, right? How many individuals, whether it be through employee relationships or through caregiving relationships, are we impacting across the country? And that growth has been significant. And one of the things I appreciate about our particular business, that's directly aligned with business results. So we don't have to make the story up, right? We want to serve more people, do it better. And that leads to ultimately business growth and scale and all the other things we're talking about. So, as we talk about that with our team, just around that purpose, it's all around allowing more people to achieve their best health and fullest lives. And I think, Addam, you've seen this live, so folks can embrace that, right? And the good news is the business results tend to follow in our business, which I also know isn't the case in every business in healthcare. So that's been foundational to our growth story, is how we talk about it to our internal audience, and it's all around that impact.
That's great. Binoy, I know that you're calling into healthcare and making a lasting impact in healthcare is something that's really critically important to you, very close to your heart. What would you add here?
I think the two things that come to mind. Number one, more of the tactical, how do you ensure that as you're growing quickly, you are rooting yourself back to why everybody is really here. It's so easy to get lost in emails and PowerPoints and this plan and this board update and sometimes forget that the reason that we're all here is to make the lives, at least for us, of providers and the patients they serve a little bit better. So I'll tell you, we've got a Slack channel, a Teams channel that just has all of our community health teams sharing stories about patients that they're serving and what they've been able to accomplish. And the stories are the best part of the day, right? It's a woman that was didn't really know how to do the right research to find the clinic to do a well visit, a pediatric clinic to do a well visit for a 3-month-old, and just doing a little bit of research, bringing the information back to her, getting her scheduled, huge win. Or someone that was ashamed to go to the food pantry because they didn't want to know, or they didn't want folks to know that they had food insecurity, and guiding that person along the way. So like driving it back to the stories of why we're all here, I think has helped us stay true to our mission as we grow. And then the second piece maybe to share, which is maybe a little bit more philosophical, but our board chair, Andrew Hayek, is firmly rooted in this concept of redemptive capitalism that's really becoming a guiding light for us. So the way that he explains it is 3 forms of capitalism. We've got run-of-the-mill standard capitalism, we all know well. We've got ethical capitalism, which is ensuring that we're thinking about the community and society within the stated goal of shareholder returns, which is great to get to. And then step 3 is redemptive capitalism, which is kind of a bit of a step further, right? In select scenarios, actually sacrificing shareholder returns or margin in the interest of your employee base or broader society. And that is, taken hold and has served as a nice guiding light for us. Like, what are the situations where we might want to sacrifice something because there's maybe long-term benefit, intangible benefit to one of our constituents, and how can we use that as a guiding light? Something, a balance that we need to strike as we grow really quickly and don't want to stray from our firm purpose and mission. Certainly has resonated. Certainly has resonated as we've grown.
What really strikes me about that, and I love that description. Oh, please, Jennifer, jump in.
Oh, sorry. I was just going to, I would like to amplify the point that Binoy made about just continuing to ground in the why. I think that is so foundational. And, one of the things that we do here at Dispatch in our meetings is we start with that patient story. We tell that patient story, whether it's in an internal meeting or whether it's in a board meeting, for example. Like, oftentimes when you get into board meetings, for example, you want to just jump right into like, okay, what were the business results? What's the strategy? How are we moving forward? We're going to take a few minutes. We're going to take 5 to 10 minutes to really ground in a patient's story and a patient journey. And I think, Binoy, you're so spot on with that. And, it's easier for our clinical teams who are out on those front lines to see those impacts every day. But bringing it back to the folks who may be in the virtual back office, for example, that don't necessarily see how the work that they are doing is impacting patients every day is so critical.
Yeah, I couldn't agree with you all more, Mike. I know you do the same thing in your meetings as well, highlighting those patient stories, sometimes bringing patients into the room to even tell their story live. And I think what all three of you really hit on there is this idea of really, in many ways, disrupting the way that care has been delivered and how people are connecting with that. And I know that the word disruptive in healthcare can mean a lot of things to people. But what I really hear all three of you talking about here is creating new ways of connecting with the patients that you care for, connecting with your stakeholders, getting the people who are in the business, maybe doing it every day on the front line, getting them more connected with the broader organization and your mission and purpose. We have found in our work is one of the most powerful tools that you can have to really leverage. And there's a lot of different ways. So thank you for articulating some of the tactics that you're doing to do that.
Yeah. And one thing I was just going to add on the stories, when we initially tried to start doing that, what we found is our staff was so used to doing things that through my lens is extraordinary, to their lens is just what they do. So we had to really find ways to pull out, what to them are very ordinary stories, but to the rest of the team, like, Jennifer, as you described, back office, and even to, some of our board members, they're all extraordinary. But this is just the things that they do every day and figuring out how to have them surface those things for us. So we've gotten a lot better, but it's pretty amazing the things that they just take for granted in their normal day-to-day life.
That's really well said. And kind of building on this, I know that as we talked about already, the people side of the business is, a really critical factor in scaling. You've all talked about in some degree, hiring, retaining, attracting top quality talent. It's something that I think every organization in healthcare is thinking about or potentially even struggling with right now. Mike, you mentioned, building the recruiting machine. And I'm just curious if you might say a little bit more about what that means and what are some of the things you're doing in terms of finding people who are attracted to the business.
Yeah, I mean, for us, that's core to our business. It's in our mission, our vision. We match caregivers with people who need care, right? That's fundamentally our business model. So, and we're typically not at a shortage of folks needing care, right? So the kind of rate limiting step is our ability to find folks who want to do this work, who are dedicated to doing this work, and connecting them with the right client, so that it sticks. So, this is probably the one area we've spent the most time in. We've invested in some of the kind of basic systems around HRIS and applicant tracking, really to enable that. but we also implemented a process that we've tweaked a number of times to try to ensure, number one, that our staff is largely entry-level jobs, so we're competing with Walmart and Target and McDonald's. So some of it is ensuring that we're able to get somebody from application to starting a case very quickly so they can get a paycheck. We've come a long way related to that. Still work to do. So focusing on the employment process, I think, is part of it. But also, gaining some sophistication around recruiting generally. I mean, we have, we kind of launched the recruiting team. I guess it's been 3 years now. Recognized that we needed to tweak that. I mean, we've since expanded that to all kind of facets of the business. And in a world where we don't have a whole lot of benchmarks, when we benchmark against ourselves as we've grown, kind of across the board, the metrics that we follow around recruiting have all improved over time. And lo and behold, so has our ability to get to clients. We're growing more organically than we have in the past. And there's some external factors that certainly help that. But I think that's just one example. But for scale, we would not have been able to pull that lever, for the business in totality.
Jennifer, I know that you're also really focused on attracting key talent. And, when you bring people into the business, what are some of the things you're doing that help connect them, not only find them, but connect them back to the organization and instill that sense of mission and why that you talked about?
Yeah. It's so important to do that, to engage folks early. I was actually last night, this is actually APP Appreciation Week this week. So first of all, thank you to all of our amazing APPs who are out there across the country serving our patients. But we were having a little event last night, and we have a transition to practice program, for example, where new clinicians can be paired with a more experienced dispatch clinician inside of our organization, really creating that connectivity around having someone that you can go to, that you can build a relationship with, build that trust with, so that you have, that can help you build your confidence as you're coming up inside the organization. And so through our onboarding processes that we have, and that we continue to evolve, making sure that people are feeling that connectivity, especially in this disconnected, world that we live in today. It's easier to do, as I said before, with some of our clinicians because they are together in a market and in an office, but it's often just a 5-minute passing in the morning before they go out, before they're dispatched out. So really, taking the time to making sure that our folks are checking in with folks that have come on board, and we're certainly on the journey. We don't have it all figured out yet. I do think one additional concept that's really important here, though, is listening to what you're hearing and acting on the feedback that you're hearing, that we hear from folks that come into the organization. So not only when people are exiting the organization, doing exit interviews, but entrance interviews to find out what made the onboarding experience valuable, what didn't make the onboarding experience valuable, and how can we continue to evolve that to make sure that we're not only able to attract the talent, but retain folks over time.
That's great. Thank you. Well, I'd love to start bringing our discussion to a close. And so I have one final question for each of you. And Jennifer, you've got the floor, so maybe you can just keep it and tell us a little bit. But what is a piece of advice that you would offer to a senior executive who is currently or about to start scaling their services organization?
Yeah, sure. I think we've talked so much so far during our time together today about that focus on mission and core values. So, I can't underscore that enough in terms of really that serving as the compass and as the guide and the North Star, if you will, in terms of, especially as things start to get challenging. So, first and foremost, I think all of us in healthcare services, feel really a deep commitment to that. But beyond that, I think it starts with the team. I think you have to have a team of folks that have strong engagement and alignment with each other, that want to really win together, right? Like, it's not about me. It's about how do we win together? How do we figure out these tough challenges? And we're more excited about doing that together than we are in our individual role or function. So really having that cohesive team and investing in getting the right team in place, I think is so valuable, because everything then builds from there. And Addam, maybe to give FMG a little plug, I know there's a tool that you've shared with us over time that says, like, look, you got to start understanding where you are before you can actually get on the journey. And part of that is having the team. So you got to know where you are, and you got to have the right team to build the strategy and then execute on the strategy and engage the broader organization. And so you can only do that when you have the right people, at the table, helping to fulfill that mission and deliver on those core values. So that's where I would start.
Addam, can I pile onto that?
Please do.
So I think you're spot on. And another plug, Addam, for you personally, you shared this equation with me a long time ago that was trust equals competency plus reliability plus rapport divided by self-orientation. That's really stuck with me. And Jennifer, just underlining what you shared, if we don't have an executive team that is, I think the probability is you're going to hire folks that are competent, that are reliable, that know how to build rapport. I think where folks can get stuck, or where you start to see cracks as you scale, is around self-orientation. And you have not only a cohesive leadership team, but a humble, learning-oriented leadership team in place before you scale is the one piece of advice I'd share back.
Thank you for that, Binoy.
Yeah, and
Mike, what would you add here?
I think you both said it very well. I think number one, the journey to scale is a journey without a destination. If there is a destination out there, we have not even come close to finding it, because we're always aspiring for the next thing. So, I think recognizing that, the train station it's going to keep moving down the tracks out somewhere in the future. I think definitely, and I know I think we've all worked with Addam through this, but having that beacon around that purpose and the shared values, I think, is incredibly important, particularly, for our situation where we're growing largely through M&A. And one of the ways kind of I test that is, over time now, if someone joins the organization, whether through M&A or from the outside or whatever, and don't have the shared values that we espouse to within the company, it sticks out like a sore thumb. And to me, that's a really good thing, right? Because that provides some sustainability to the culture, and something, we're going through kind of our next phase now to ensure that we don't lose that as we continue to get bigger. So I think that's really, nothing else matters without the people piece and that beacon around where we're going and what we're about. I think the other things that I would add to that, and these are the things that we're grappling with now, and I think will forever, is how do we evolve our processes to get more value out of that scale? From where we started, I know when I joined CBC at the end of 2017, I had told the team, I'm not looking for a best practice. I'm just looking for a good one that we can replicate, and that becomes the standard. And the bigger we get, we can now look for best practices internally and externally to try to measure ourselves against, to make sure we're getting that value. Because, we view our support center, we are a cost center, right? So we have to deliver value from a corporate standpoint to the folks in the field. That happens through process and then through technology. We have invested pretty heavily in technology as an enabler, but we've only scratched the surface in terms of optimizing the use of that technology to be able to streamline process. So, I mean, I think it's constantly, going back, challenging ourselves. I think, you mentioned humble. I've worked in a couple of healthcare organizations. Humility's got to be part of it, right? Because those of us sitting right here, we're not touching clients, right? And that's where the business happens. So I think making sure that the leadership team recognizes that, and we're here to support the work, and hopefully lead it to a better place. But, I guess the bottom line is and I got a team, some of which are sitting in the room next door watching this. They're thinking about what's next all the time. And I think that's also an important trait as we continue to move things forward.
Wow. Very, very powerful, wonderful advice, very applicable. And I'm certain that many of our attendees can resonate with both the challenges as well as the advice that you're suggesting here. I'd love to draw this to a close. I found it to be a great conversation. I hope that everybody else who is attending has. I'd like to thank our panelists again, Binoy, Jennifer, and Mike, for taking some time to share your wisdom and the lessons learned along your respective scale journeys. You all three have very exciting stories right now that we're following and tracking with great interest. And there's just so many other great stories out there of healthcare organizations that are just scaling for good and doing amazing work. And so want to thank you for taking your time today to share some of your insights and your wisdom. It's been a pleasure to be on the journey with you. And also, once again, just to thank our modern healthcare partners in helping to sponsor what I think is a really important and a super high value conversation. So would like to thank everybody. And Maria, if you're still with us and there's anything else that you want to say to close us out, would welcome you to draw us to a close.
Yes, thank you, Adam, and thank you to our speakers for this great discussion. We'd also like to once again thank our sponsor, FMG Leading. For more information about them, please visit fmgleading.com. Thanks, everyone. Have a great day.